Hi, and welcome back to my channel, Learning Biology with Dr. Vanessa, where I take difficult biological concepts and make them easy to understand. Today, we're diving into a vital part of the skeletal system that often gets overlooked: joints or articulations. Bones get a lot of attention, but bones can't move by themselves because they are too rigid to bend. That's where joints come in. Joints are the connection point between bones that allow us to bend, twist, run, write, and even nod our heads. In this lesson, we'll explore what joints are, how they're classified, the structure and function of different types of joints, and we'll wrap up with some clinical connections to bring it all together. Let's begin. What is a joint? A joint, or articulation, is any point where two or more bones meet. Some joints are immovable, like the sutures in your skull. Others are slightly movable, like the joints between vertebrae, but many are freely movable, like your shoulder or knee. Joints are essential for movement, support, flexibility, and shock absorption. Note, though, that the joint connects bones and allows movement to occur, but the actual motion happens when muscles that are attached to those bones contract and pull on them. Joints can be classified in two major ways. The first is structural classification. This is based on what material connects the bones and whether a joint cavity is present. Fibrous joints are where bones are joined by dense, irregular connective tissue. There is no cavity. Movement of these joints varies from immovable to slightly movable. Cartilaginous joints are where bones are connected by hyaline or fibrous cartilage. There is again no cavity, and movement of these joints will vary from immovable to slightly movable. And then there are synovial joints. Most of the joints in your body are synovial joints and are the most movable joints. This joint connects bones by a fluid-filled joint cavity. Movement of these joints varies from slightly movable to freely movable. And then there's the functional classification. This describes how much movement the joint allows. We have synarthrosis, which are immovable, and so fibrous and cartilaginous joints would fall into this category. Amphiarthrosis, which are slightly movable. Again, fibrous and cartilaginous would fall into this category. And then we have diarthrosis, which are freely movable, where we would see those synovial joints. So we're going to go and take a closer look at each of these types. We'll start with fibrous joints. So structurally, these are fibrous joints, and functionally, they are mostly synarthrosis with some amphiarthrosis. So these fibrous joints are connected by dense irregular connective tissue, like we just talked about, and then they allow little or no movement. We find three different types of fibrous joints. The first are sutures. These are found between skull bones, and the interlocking edges of the sutures give them added strength and decrease their chance of fracturing. In infants and children, these joints are slightly movable, but in adults, the sutures are immovable. Some sutures are completely replaced by bone in adults and become a synostosis or bone joint. An example is the frontal bone, which grows in halves and then are joined completely together at the suture line. Then we have syndesmosis, which is a fibrous joint where there is a greater distance between the two articulating bones than we see in sutures. And because of this bigger space, there's going to be more dense, irregular connective tissue. These are slightly movable. There are three different types of syndesmoses: an interosseous ligament, such as the anterior tibiofibular ligament, which connects the distal tibia and fibula; an interosseous membrane, which is going to be a longer sheet of dense irregular connective tissue that binds neighboring long bones together. Both of these allow for slight movement. And then there is a gomphosis, or dentoalveolar joint. These are peg and socket joints like teeth in their sockets, and they are going to be anchored by the periodontal ligament. Next, we have cartilaginous joints. So structurally, they are cartilaginous, so they are associated with either hyaline or fibrocartilage. And then functionally, they are synarthroses or anthiarthroses. So either immovable or slightly movable. There are two types of these. Synchondroses, which are bones that are joined by hyaline cartilage. We see this in epiphyseal plates. So in growing children, there's a portion of that bone known as an epiphyseal plate where the growth is going to take place. And so this would be an example of a synchondroses. Or we can see this in the first sternocostal joint. And these, again, are usually immovable. And then we have symphyses, which are where the bones are connected by fibrocartilage. These are found in the midline of the body, for example, the pubic symphysis found between the anterior surface of the hip bones and also at invertebral discs found between the vertebrae. These allow for limited movement and provide strength and flexibility. And then there are synovial joints. So structurally, synovial joints are synovial, and then functionally, they are diarthroses. Now, synovial joints are going to be the most complex of the joints. These are the classic joints that we think of. We find them in the knees, the elbows, the shoulders, and they have key features that distinguish them from other types of joints. They have a joint cavity or articular cavity, which is a fluid-filled space that separates bones. There's articular cartilage, which is hyaline cartilage that covers the bone surfaces, reducing friction. There's an articular capsule, which is a two-layered capsule that encloses the joint, where it has an outer fibrous layer for stability and then an inner synovial membrane, which is going to produce synovial fluid. And then, of course, we're going to have that synovial fluid in this joint, which is a viscous lubricant that reduces friction and nourishes the cartilage that is there. There are also ligaments associated with these joints. These connect bone to help stabilize that joint. Nerves and blood vessels are also found here that are going to innervate the joint and supply nutrients. And sometimes we find bursa, and these are going to be fluid-filled sacs that reduce the friction between tissues. Synovial joints are all diarthroses, which are freely movable joints, but not all move in the same way. There are 6 major types of joints that are classified by shape and motion. The first are the plane or gliding joints. This is where the flat surfaces of the bones glide over one another, allowing back and forth and side-to-side movements. Examples include intercarpal and intertarsal joints. The next are hinge joints. This is where the convex surface of one bone fits into the concave surface of another bone. Their motion is similar to a door opening and closing on its hinge. Examples include the elbow, knee, and interphalangeal joints. We have a pivot joint. This is where a rounded bone fits into a ring or sleeve and allows for rotation around a single axis, kind of like turning a doorknob or shaking your head no. Examples include the proximal radial ulnar joint, which allows the palms to turn anteriorly and posteriorly, so you can flip your palm up or down while the head of the radius pivots, and the atlantoaxial joint, where the atlas rotates around the axis and allows you to shake your head no. Then there are condyloid or ellipsoidal joints. This is where the oval surface of one bone fits into a depression of another bone, and this allows movement into 2 planes. Examples include the radiocarpal or wrist joint and the metacarpophalangeal joints between the metacarpals and proximal phalanges of the 2nd through 5th digits. The saddle joint is where the articular surface of one bone is saddle-shaped and the articular surface of the other bone fits into the saddle. The movement of this joint is the same as the movement at a condyloid joint. Examples include the thumb, where we have the carpometacarpal joint, and the sternoclavicular joint between the manubrium of the sternum and the clavicle. And then finally, there's the ball and socket joint. In this joint, the rounded head of one bone, the ball, fits into the cup-like depression of another bone, the socket. This is the most freely movable type of synovial joint in the body. It allows movement in multiple directions, including rotation, making it extremely versatile. Examples include the glenohumeral joint that we see in the shoulder and the hip joint. Now that we've talked about the 6 major types of synovial joints and how they're classified by their shape and motion, we're going to talk a little bit more about the types of movements that these joints allow. So the first set that we're going to talk about are flexion and extension. And here we have flexion, where flex is to bend. So in this movement, we have a bending, like bending the arm. And in this movement, we're going to decrease the angle between articulating bones. In extension or extend, which means to stretch out, we're going to increase the angle between the articulating bones. So hinge joints like the knee and elbow can accomplish this movement. Other joints that can accomplish this movement are the condyloid, saddle, and ball and socket joints. Then we have abduction and adduction. These movements move away or toward the midline. So in abduction, the movement is going to be away from the midline, and in adduction, it's going to be the movement toward the midline. So raising your arm or leg out to the side moves it away from the midline or abduction, and then lowering your arm or leg back down to your side would be adduction, or moving it toward the midline. These movements occur at joints that permit motion in more than one plane, including ball and socket joints, condyloid joints, and saddle joints. Rotation is a type of movement where a bone turns around on its own axis. Unlike flexion or adduction, rotation does not move a body part away from or toward the midline. Instead, it twists around a central axis. Pivot and ball and socket joints can do this movement. So an example of this is the atlantoaxial joint, where you can shake your head no, or the hip joint, where we can rotate the thigh inward and outward. And then there's circumduction. This is a circular movement that combines flexion, extension, abduction, and adduction. If you were to draw a big circle in the air with your arm straight outstretched, your hand would be tracing the outer edge of a cone. That's circumduction. This occurs at ball and socket, condyloid, and saddle joints. And then there's special movements. Special movements include pronation and supination. These two terms are going to refer to the rotational movements of the forearm and hand, and they happen at the proximal and distal radial ulnar joints. So when we rotate our palm. So supination is going to be rotation of that forearm so that the palm faces up. In this position, the radius and the ulna are going to be parallel. Now, if you flip your palm down, so you rotate your forearm so that the palm faces down, this is pronation. And in this case, the radius is going to cross over the ulna. And so ways you can remember this is supination equals soup. You can hold soup in your palm if your palm is up. And if you flip that palm down, then that's pronation. You can think of prone like lying prone. Another group of special movements are inversion and eversion. Inversion and eversion are special movements of the foot, specifically at the intertarsal joints. Inversion is the movement of the sole of the foot inward so that it's going to face the midline of the body. Example is when you roll your ankle outward and the bottom of your foot turns inward. This is common in ankle sprains, Most ankle sprains happen during excessive inversion. Eversion is the movement of the sole of the foot outward, away from the midline. An example is when you shift your weight to the inner edge of your foot, and then the sole is going to face laterally. Some memory tips for this is inversion, the foot turns inward, and eversion, the foot turns external. Another group is elevation and depression. These are movements in the vertical, so superior and inferior direction along the frontal plane. These motions are most commonly observed in the scapula, the shoulder blade, and the mandible jaw. Elevation is raising a body part upward, moving it superiorly. Examples are shrugging your shoulders, closing your mouth, lifting the rib cage during deep inhalation. Depression is moving a body part downward or inferiorly. Examples of this includes lowering your shoulders after a shrug, opening your mouth, or returning the rib cage down after inhaling. A memory tip for this is elevation, the elevator goes up, depression, pressing down. The next group is protraction and retraction. These are movements that occur in the horizontal or transverse plane, moving a body part forward or backward along a straight path. These are commonly seen at the scapula, the shoulder blade, or the mandible, the jaw. Protraction is moving a body part forward away from the spine or midline. Examples include pushing your shoulders forward, like when you're reaching out or slouching, or sticking your jaw out like making an underbite. Retraction is pulling a body part backward toward the spine or midline. Examples include squeezing your shoulder blades together or pulling your jaw back in after protraction. A quick memory tip for this is protraction is to push forward. Retraction is to return back. The next set is dorsiflexion and plantar flexion. These two terms describe movements of the foot at the ankle joint, specifically the talocrural joint, which is a hinge joint connecting the tibia, fibula, and talus. Dorsiflexion is bending the foot upward towards the shin. The angle between the dorsum, top of the foot, and the leg decreases. Examples are lifting your toes off the ground while your heel stays planted, or walking on your heels. Plantar flexion is pointing the foot downward away from the shin. The angle between the top of the foot and the leg increases. Examples of this would be standing on your tiptoes or pressing down on a gas pedal. A quick memory trick for this is dorsiflexion. The toes go toward the dorsum or the top of the foot. And in plantar flexion, you point your toes like you're planting your foot down. And then the final movement we'll talk about is opposition. Opposition is a special movement of the thumb that sets humans and some primates apart from most other animals. It involves the thumb moving across the palm to touch the tips of the fingers, especially the index finger. Movement that brings the thumb towards the fingers. In this movement, you're grasping or pinching objects. So you're grasping a pencil, buttoning a shirt, holding a coin, or picking up a small object. These are all examples of opposition. The fact that we can take that thumb and touch the tips of our other fingers to do things. So a quick memory trick for this is opposition is equal to opposable thumbs. That movement that lets that thumb oppose the other fingers. Joints are vulnerable structures, especially synovial joints. Common joint issues include dislocations, when bones are forced out of alignment, sprains, the stretching or tearing of ligaments, torn cartilage, especially in the knee, in the meniscus, arthritis, where we have inflammation of the joints, and there are many types of arthritis, including osteoarthritis, which is degenerative and age-related, rheumatoid arthritis, which is autoimmune, and gouty arthritis, which is uric acid crystal accumulation. And then there's bursitis or tendinitis, where we have inflammation of the bursae or tendon sheaths. These disorders affect mobility, comfort, and quality of life, making joint health an important part of medical and wellness practice. Let's summarize what we've covered. A joint is where two or more bones meet. Joints are classified structurally, either fibrous, cartilaginous, or synovial, and functionally, synarthrosis, amphiarthrosis, and diarthrosis. Synovial joints are the most mobile and complex of the joints, and there are 6 types of synovial joints, each allowing specific types of movements. Movements can include things like flexion, extension, rotation, and more, and clinical issues can include arthritis, dislocation, and injuries to cartilage or ligaments. Thanks for joining me on this tour through the anatomy of joints. From the immovable structures in your skull to the freely moving shoulder joint, articulations are the key players in how we move, interact, and live. If you found this video helpful, make sure to give it a like and share it with your friends. And don't forget to subscribe and allow notifications so that you never miss out on new content. Thanks for watching, and I'll see you in the next video.